West Virginia Suboxone doctor. If you are an opioid addict looking for help, you may wonder if Suboxone is the proper medication for you. Suboxone can be a lifesaver for those struggling with opioid use disorder. Finding a doctor who can prescribe it and know how to monitor its use is crucial. In West Virginia, many doctors can help you get started on Suboxone therapy. In this video, we will discuss finding a suitable West Virginia Suboxone doctor for you. We will discuss what to look for in a Suboxone doctor and how to ensure you get the best medical treatment possible. We'll also provide some resources to help you find a qualified Suboxone provider in your area. Suboxone is a medication used to treat opioid addiction. It is a combination of buprenorphine and naloxone, which works by binding to the same receptors in the brain as opioids. However, buprenorphine has a much weaker effect than opioids, so it does not produce the same high. Naloxone is an antagonist which blocks the effects of opioids. Suboxone use is part of a complete treatment program that includes counseling and behavioral therapy. Taking Suboxone precisely as prescribed by your doctor is crucial. You should also first talk to your doctor before you stop taking it. If you miss a dose and it's almost time for your next dose, skip the missed dose and take the next one at the regular time. Do not take 2 doses at the same time. If you take too much Suboxone, call your doctor or go to the nearest hospital emergency room right away. Opioid addiction is a serious problem that can have a profound effect on every aspect of your life. If you or someone you know is struggling with opioid addiction, seek professional help as soon as possible. Many signs that may indicate that someone is struggling with an addiction to opioids include taking opioids in larger doses or for an extended period than intended, unsuccessful attempts to quit taking opioids, spending a significant amount of time obtaining, using, or recovering from the effects of opioids, strong cravings for opioids, continuing to use opioids despite negative consequences, such as job loss or relationship problems, using opioids despite physical or psychological problems caused by their use, giving up important activities to use opioids, using opioids in dangerous situations, such as driving while under the influence, continuing to use opioids even though it is causing financial difficulties, lying or being secretive about opioid use. Seek professional help immediately if you or someone you care about displays any of these signs. Opioid addiction is a serious condition that can have potentially deadly consequences if not treated. With the help of a qualified West Virginia Suboxone doctor, you can begin the journey to recovery and get your life back on track. Medication-assisted treatment is a comprehensive approach to treating substance use disorders that combines behavioral therapy with medications. Suboxone is one type of medication-assisted treatment that uses buprenorphine to help reduce withdrawal symptoms and cravings. Studies have shown that medication-assisted treatment can be an effective treatment for substance use disorders, with abstinence rates ranging from 40 to 60%. However, the success of medication-assisted treatment depends on several factors, including the individual's motivation to change and their overall support network. For some people, medication-assisted treatment may be a necessary step on the road to recovery, while others may prefer to abstain from all substances without using medication. Ultimately, the individual and their healthcare provider should decide whether to use medication-assisted treatment. Despite its success rate, Suboxone is often underutilized in treating addiction. According to a recent study, only about a third of people who could benefit from Suboxone actually receive it. One reason is that many people are unaware of it or how it works. In addition, some people hesitate to take medication for their addiction, fearing that it will make them reliant on drugs. However, the truth is that Suboxone is highly effective at treating addiction and has a low risk of addiction. When used correctly, it can help people overcome their dependence on drugs and lead healthy drug-free lives. If you or a loved one is struggling with opioid addiction, Suboxone treatment can be a lifesaver. However, finding a Suboxone doctor who is experienced and qualified to prescribe the medication is crucial. Here are a few tips to help you find the right West Virginia Suboxone doctor. Ensure the doctor is certified to prescribe Suboxone and has experience treating opioid addiction. Some doctors believe in tapering patients off of Suboxone, while others believe in maintenance therapy. Choose a doctor whose approach aligns with your goals for treatment. Talk to friends, family, or your primary care physician to get recommendations for qualified Suboxone doctors in your area. Read reviews and check out the doctor's website to learn more about their practice. Once you've found a few potential doctors, schedule a consultation to meet with them and discuss your treatment options. You could start with a simple Google search for Suboxone doctors near me, West Virginia Suboxone doctors, or Suboxone treatment in West Virginia. It should give you a good starting point to begin your research. Online directories that list Suboxone doctors by state, such as the SAMHSA Provider Locator. Your insurance company may have a list of Suboxone doctors in your area who are covered under your plan. By following these tips, you can be confident that you're getting the best care for your opioid addiction. Suboxone is a prescription medication used to treat opioid dependence. It must be taken only once daily or as prescribed by your doctor. It is a sublingual film that dissolves in your mouth. The Suboxone film contains two active ingredients, buprenorphine and naloxone. Buprenorphine is an opioid partial agonist that blocks the effects of other opioids and reduces withdrawal symptoms. In contrast, naloxone is an opioid antagonist that reverses the effects of opioids and prevents abuse. Side effects of Suboxone may include constipation, headache, nausea, vomiting, fatigue, dizziness, blurred vision, and dry mouth. You should not take Suboxone film if you are allergic to buprenorphine or naloxone. You must tell your doctor about your other medications, as they may interact with Suboxone. Suboxone should not be used during pregnancy unless the potential benefits outweigh the potential risks. If you become pregnant while taking Suboxone, you should stop taking the medication and consult with your doctor. Recovery from addiction is a lifelong process, and there will be setbacks. However, staying on track with your recovery plan is crucial to maintaining sobriety. Here are some tips for staying on track with your Suboxone recovery. Make sure to take your Suboxone as prescribed. This medication is essential for managing withdrawal symptoms and cravings. Attend all your scheduled counseling appointments. These sessions provide valuable support and guidance. Avoid triggers that could lead to relapse. It may include avoiding places where you use drugs or alcohol, or people who are still using. Seek out a support group for people in recovery. It can provide invaluable peer support and motivation. Remember that relapse is not a failure. If you do slip up, get back on track as soon as possible. And don't give up on your recovery goals. We understand that opioid addiction is a serious problem that requires treatment by a trained medical professional. That is why we've created a directory of West Virginia doctors specializing in the use of Suboxone for treating addiction to combat the opioid crisis in the state. Our platform allows you to connect with treatment providers who treat opioid abuse via telemedicine and in-person appointments. We also make it easy for you to schedule appointments with West Virginia Suboxone doctors near you and providers who accept both Medicare and Medicaid. If you are struggling with addiction, don't wait any longer to get the help you need. Find a Suboxone doctor at suboxonedoctor.com today and start your long-term recovery to get your life back on track.